Doctors, the next concept we're going to discuss is what is called layering of manual therapy strategies. Of course, we have probably at the core ischemic compression, which most of us have in our chiropractic toolbox. We also have a technique called cold distraction. Initially, it was performed with epichlorite or fluoromethane, fairly expensive, somewhat toxic cold spray. A little bit more difficult to acquire these days. There are several variations. If you're interested, we actually put those in your notes. My favorite substitute is the Cryo Tube. Simple little instrument. It's got a neoprene handle. It's got a metal applicator, and inside of the applicator there's a gel. You put it in the freezer, it freezes, never runs out. You don't have to buy any more. This cold tip allows you to use cold distraction very efficiently and eloquently with the patient. I usually apply a little bit of sauna gel or some type of lubricant. In this particular case, we found a tender nodule in the upper trapezius musculature, and so we're going to use cold distraction on that particular nodule. And at the same time, we're going to apply ischemic compression. But now let's take it another step further. Let's go ahead and layer it with an additional technique. Betty, why don't you take your ear down to your left shoulder? And we're actually, once she gets to the end of her ability to laterally flex, then we're going to help her a little further while we're doing ischemic compression and cold distraction. Well, it doesn't stop there, because we also have contract relax. With contract relax, we're actually going to have the patient flex toward the contracted nodule. We're going to activate the Golgi tendon organ to cause a relaxation in the musculature. In this particular case, we're going to use anywhere from 50 to 80% of the patient's maximal contraction. And we're going to combine it with cold distraction and ischemic compression. And this time, Betty Jo, I want you to laterally flex your right ear towards your right shoulder while I resist. And I want a nice vigorous stretch, not as much as you have, but probably 75% of your strength. And you'll have the patient perform this maneuver for about 7 to 10 seconds, and then relax. Then you can go check the musculature, see if you've affected the nodule the way you want to. Also, take a look at lateral flexion, comparing side to side if we have, let's say, in this case, a muscular imbalance. Another technique that we can layer is reciprocal inhibition. One of my favorite techniques, and it's best suited for the acute patient. And the reason for that will become obvious in just a moment. In this case, we're using a concept, a neurological concept, to affect the body in a way that we desire. Let's say that I want to contract my bicep. Well, reciprocal inhibition occurs through an interneuron at the spinal cord level. When my brain tells my bicep to contract, there's a reciprocal inhibition impulse transmitted through the interneuron at the spinal cord level that tells my triceps to relax. So, if we contract an agonist, we get natural relaxation of the antagonist. So that's a concept that we can use throughout the body. Let's say in this case that we want to affect some relaxation in the right lateral flexors. Well, what we'll do is we'll ask the patient to laterally flex to the left. Betty Jo, can I have you apply about 30% of your strength to my hand? And as she's laterally flexing to the left, reciprocal inhibition is telling her right lateral flexors to relax. Well, again, let's layer. Let's take cold distraction and ischemic compression while we're doing reciprocal inhibition. So now we have the neurological system telling the muscle to relax, we have cold distraction, and we have ischemic compression occurring all simultaneously. So take a look at your chiropractic toolbox, especially your manual therapy techniques, and become creative and MacGyverize and improvise and come up with new and novel ways to affect tissue in your patients that needs to be corrected.